My name is Denora Martinez Anderson. I am the director and nurse practitioner at Health Services here at Southwestern University. We welcome you to Southwestern, our beautiful campus. And so, first and foremost, let me congratulate all the students that have chosen Southwestern. Way to go. Health Services at Southwestern University is located in the Prothro Center, which is right next door to the Olin building. This is the Olin building that we're in. We're located right next door in a state-of-the-art LEED building, which we're really proud of. It's beautiful in there. It's awesome. We are located on the second floor, Suite 200, and we are also housed with counseling services. So if you find yourself meandering over to the next building, you can go up the stairs, and we will be in that corner on the second floor of the Prothro. My goal today is not to overwhelm you with information, but to provide you the reassurance that we are here to support your student. We have a nurse practitioner, we have a registered nurse. We also have 3 doctors that come on a weekly basis. 3 days out of the week, they are here seeing students by appointment for 2 hours every day. And so, of course, we have our morning clinic, and in the afternoon, I see our students in case they need to be seen. So the other thing that we do is we try to take care of the most common illnesses. We do try to take care of the continuation of chronic disorders or conditions. For example, depression, like I mentioned. One of the things that I would like to add to that is that if your student has a chronic condition or already has been diagnosed with a condition that needs medication, we would love to hear from the doctor. The doctor that diagnosed them with that illness, we would love to get a little note, a post-it, an email, something to tell us, hey, this is what this child has, this is the medication that I'd like for you to give them, and this is the blood work that I'd like for you to continue to check, and fax it to me. This white sheet basically tells us what our student health benefits provides for you, the student health benefits plan that Southwestern University is already including within your tuition. There's no extra fee, there's no fine print, this is already included in the tuition. This will basically serve as a secondary supplemental coverage for your student, okay? Which leads us to the yellow sheet. And the yellow sheet is a letter for you. It's information for our parents so that they understand what we're going to be doing this fall. And as you can see, it says here that on the 3rd paragraph, in order to maintain service levels during a time of rising healthcare costs and increased demand for services, we have decided to begin billing all insurance health plans for the services provided by our staff here. And so basically what we're going to be doing, and what we have noticed in the last year, is that the services that we provide are primarily preventative services, okay? And because of the Affordable Care Act, making that distinction, the insurance companies are now covering those at least 100%. And so nothing should be coming out of your pocket. But if it does, that's when the student health benefits kicks in. But anyway, the other thing that I wanted to share with you is that, let me explain how the outpatient sickness works. The outpatient sickness says $700 of maximum per sickness. So let me give you a couple of examples so that you probably understand that. But those of us that didn't understand it at first, I'm just going to repeat this just for my own sake, really. Just a reminder. So when a student comes in, let's say for example, Susie comes in with a sore throat, and it is strep. I test her for strep. It is positive. I write her a prescription for an antibiotic. She takes it to the pharmacy. She pays $20 copay because she has primary insurance. And so that $20 receipt that is stapled along with God knows how many pages of information to the little baggie of your pills, you guys follow me? That little receipt that has her name, the prescription number, and the cost is the part that she needs to bring to me so that she can submit it for reimbursement. Up to $700. Okay. okay, for that sore throat, okay? So what happens is that Susie's been wearing her cute little shoes and flats, and you know, she's gotten an ingrown channel after her last petty. So she's walking and limping. Miss, my toenail hurts. Oh my goodness. Susie, you're gonna need to go to the doctor to get your toenail removed. So guess what she's gonna have to do? She's gonna go to the doctor's office, she's gonna present her ID card, and the ID card will tell the lady at the desk, oh, she's an SU student. We don't charge them. At Family Medical Center, that's where we send them because they are contracted with us to come here, and we have a connection with them. We have a relationship with them, okay? And so she gets that taken care of. It's a procedure. Then you get an explanation of benefit sheets that says, hey, this is not a bill. This is what you may owe. This is what you may need to pay, that sort of thing. How many of you guys have seen something like that, similar to that? That little explanation of benefits sheets is what you need to go ahead and submit to our student health benefits plan. And it will cover up to $700 of that sickness. So up to $700 of whatever your primary insurance does not cover for the sore throat. And then up to $700 for the toe that your primary insurance does not cover. Does everybody follow? Any questions on that?
So, will they bill your primary first and then?
That is correct.
You have to bill the primary first.
That is correct. The question was, are they going to bill my primary first? Yes. That's the plan. However, we understand that there are some people that do not have primary. We understand that. And that's when this one will be the one that will be used. This starts when school starts. It doesn't cover them right now, sorry.
But even over Christmas break.
Over Christmas break, it's covered for the whole year. That's right. She wants to know, do we need to sign up for this? No, there's no signing up. This is automatic to your student once you pay your tuition. But the good news is they only have to turn in one claim form per year. It's one claim form. I know it's confusing, but it's one claim form. The reason that they only are requesting one claim form was because of the tediousness of having to fill one every single time. The claim form includes their demographics, the most important information, and at the very bottom it does also include questions about their health insurance. If they're covered by their primary, they're covered by their mom or dad or whatever. So that information is only needed one time. Unless there's been a change in their insurance, that's when, of course, we go there when we ask the student when we're face-to-face, has your insurance changed? No, it hasn't. Okay, perfect. Then go ahead and bring the receipts and just put your name, your ID number, and submit that, and they will pick it up over there in receipt land, and they somehow put them together and they know where to go. I mean, that's information that we do have to tell our students. Put the information, put the address where you want the money to go back to, period. And they go, well, what do you mean? Do I send it to my mom or to me? I'm like, hey, don't ask me. We do not give allergy shots. That's a good question. We get that every year. The reason that we do not give allergy shots is because I do not have oxygen in my office. And that's just something, that would be something else that I would need pharmaceutical permission from. And so we don't store allergens, and so that would make it very difficult for us. But we do have a resource for our students in case they do need some allergy shots. For those athletes, for those parents of athletes, one thing that I'm not sure if you've been told or informed of, the NCAA is now requiring the sickle cell anemia status for your student. And so an easy way to find that out is, do you remember when they poked their heel when they were babies?
Yes.
That is a newborn screen, okay? That newborn screen is what you need. You need a copy of the newborn screen because that will tell you that's a test for sickle cell anemia. That way you don't have to do the blood work on them again. But if you don't have access to your child's newborn screen from your pediatrician or when they were born, if you don't have access to that, you certainly can go to, like for Texans, you can go to the Department of Health here. You can call them and find out if you can get a copy of that. so that you can turn that into the athletic department. But that is going to be something that is new to make sure that NCAA is now wanting proof that they do not have sickle cell anemia before they're actually on the field. So that's going to be something that's new, that's coming down the pike, and that's going to be something that's going to be required for those of you guys that have athletes. It's going to be something important, okay? And also the athletes get a second coverage. So you have primary, this is secondary, and then the athletes get an extra layer of coverage. But yeah, when it comes to health information, you're absolutely right. We will not be able to confirm nor deny any information to you regarding your student if you call us and they're 18 and above. They're under the age of 18, they're 17 and a half. We will share that information, and we will have to tell the student, of course, let them know.